Let's talk to Ian, who is in Shropshire, wants to talk about that. Good morning to you, Ian.
Good morning.
Good morning. What do you want to say?
I was just saying that it's purely a financial consideration. If people such as the Royals and others as well that have bags of money can afford to go private, then please let them do so, because it reduces the financial burden on the NHS. It's purely a financial burden, as I see.
But no, you see, look, I think people should be free to spend their money there how they want. I've got no issue with private healthcare or anyone using it. My issue is that if politicians, if Rishi Sunak and Keir Starmer did the same, and they're both wealthy men, yes, Keir Starmer's a wealthy man, as well as Rishi, not in the same league, but if they would be castigated for it on the basis like, why is the NHS good enough for you and your family when it's supposed to be good enough for the rest of them? Why do we not hold the Royals to the same standard? Because the same doctors work in the NHS hospitals as the private hospitals, the same nurses as well. Every time someone is operated on in private, they're going ahead of the queue for the public sector, and they're probably using the same staff who otherwise would be employed on those extra shifts in the NHS.
Yes, but on the other hand, I'm looking at it from purely the financial point of view. If Starmer or Sunak, I mean, Rishi Sunak's wife's got money coming out of her ears, so if they went private, so much the better. Okay, fair
but they
enough.
would be torn apart in the media and torn apart by the public for that. 7.5 million people on waiting lists for operations, and the Prime Minister went private. He'd be out of office the next day.
They wouldn't bother me in the slightest. In fact, I would encourage it, because any help that the NHS can get financially is welcome. I mean...
here's what I'd say to you, and it's the same with a lot of services. A service for the poor is a poor service. When the politicians have the option of, like, state schools, when they have the option of going to private school, or what they tend to do now is they get themselves into the catchment area of a selective school, they go to a religious school or something, whereas they don't have to go to the bog-standard comps that most of us went to. When they're able to buy their way out of healthcare, they don't worry about these services. They don't get buses, so they don't worry about bus services. If they don't have to use a service, it's not in their interest. They don't have to worry about it, making sure it's the best it can be.
Yes, but when I had the prostate operation, I went NHS and it was fine. There was no shortage of nurses to look after me, and the doctor wielded his Black and Decker, and it was done, and I was in and out in a week.
Well, I'm good. So... I'm glad you're well. We'll have to agree to differ on this one, but thank you so much for calling in. I really appreciate it.